whenever we're thinking about the state of childcare in Ohio, it really can't be separated from this systematized precarity that's at the heart of it. And while there have been lots of good efforts, many of those efforts have been in response to federal mandated increases in both the provider rates and to bring down co-pays. Those federal mandates are now under attack. We've all seen the news. Those steps that helped Ohio get on the right track are now being rolled back at the federal level. And I would love to see Ohio show some leadership and a little bit of bravery and actually move forward with implementing those changes, even despite what's going with the federal mandate being taken off the table. They could still do those things. If they were good ideas before, they're still good ideas. And this enrollment versus attendance question, it's getting a lot of myth building around it. But all that is aligning how the public sector childcare funding happens in that world with how tuition is paid in the private market. When you pay your tuition at a private pay place, you're paying for a week or a month ahead. You're paying for that spot. If you take your kid on vacation, well, you just paid for the week. Sorry, but that's how it works, right? That creates stability. It allows childcare providers to plan. It is necessary to have a functional, it is not a surprise at all. The childcare providers are like, I have no idea if I will be here whenever you can't make a plan to even have a spot. So that rule change, I would love if Ohio just said, you know what? This was a good decision before when it was mandated. We're still going to move it. The money has been allocated in the budget. We could do a 7% copay cap. It was a good decision before. It's a good decision now. The money has been allocated. We act as if we are in a state where we're just broke all the time. And we're going to have big budget holes coming up from all this stuff happening at the federal level in health, in food security, and education, and in childcare. And we're like, my goodness, how do we fill these holes? Well, let me tell you, Ohio passed a flat tax last budget that's going to take $1.68 billion out of the kitty over this biennium. The majority of that tax cut is going to people who are in the top 1%. We're talking about people on average who are earning $1 million. I'm pretty sure they don't need that tax cut. We do need a functional child care system, just like we need functional roads and bridges. So we can do this. Like Ohio could actually solve this problem. The money exists, the policies, we know them. We can pick from the best. We need the political will to make it happen. That's it.